All right, I'd like to call to order this regular meeting of the Boulder Valley Board of Education for Tuesday, February 23rd, 2021. Laura, would you please call the roll?
Garcia.
Here.
Gephardt.
Here.
Marquis.
Here.
Myers.
Here.
Sargent.
Here.
Sweeney Moran.
Here.
This.
Here. All right, please join us in the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, I'd like to remind everybody that the mission of the Boulder Valley School District is to create challenging, meaningful, and engaging learning opportunities so that all children thrive and are prepared to lead successful, civically engaged lives. Thank you all for joining us as we approach in a couple of weeks the one-year anniversary of the pandemic. We're very happy to have you here virtually, but we're always looking forward to being back in person sometime soon. I also just want to remind everybody that we have 2 candidate meetings for prospective school board candidates coming up on March 9th at 11:30 a.m. and at March 29th at 6:30 p.m. if you're interested in running for the Board of Education next November. We'll also be posting on our website the timeline and the steps that you need to take to become a candidate in the school board election. We're looking forward to speaking to anyone who's interested. If you want to hear about our experience, you can contact any one of the board members and we can give you some thoughts about what the job entails and how rewarding it is. So as usual, we'll start with a superintendent's report, and this will also have a COVID portion, Dr. Anderson?
Yes, it will.
Okay, great.
Thank you, Board President Marquis, board members. Good evening, everyone. Good to see you. Wanted to start this evening in my comments with some thank yous. Board members, as you may know, and many in our community know, 2 weekends ago, we had incredibly cold temperatures, and our heating units at Lafayette Elementary School, unfortunately, due to some equipment malfunctions, ended up freezing over. I want to just thank our operations maintenance team, Rob Price, Molly McLaughlin, Scott Stevens, our maintenance and bond team, Principal Stephanie Jackman, for all of the work that they did over the past week to make sure that we were able to bring students back on Tuesday in a heated building. Not a small feat. I want to thank our parents and kids for being patient with us and understanding as we worked through that. But just wanted to start my comments this evening with some just sincere thank yous. It was incredible work. We had folks working around the clock to try to solve what was a really, really complicated problem. And so just want to share my appreciation. We was excited to join many of our board members on a tour of University Hill Elementary School yesterday. As the community may know, and I know the board knows, that is, we've had some bond work happen over the course of the past year. Incredible work, a new cafeteria, new playground, new buildings for our preschool programs. Just building looks beautiful. I know that this summer we'll be working on heat and air for the 2nd and 3rd floors, which I know that earlier in our work session, we talked about the heat in New Vista, which certainly can get hot, but those 2nd and 3rd floors, Uni Hill certainly can get really warm as well. So we're very excited about that. Just want to thank our taxpayers for their continued support. We wouldn't be able to do this work without your support. And so just a genuine thank you. It was a great opportunity to be at Uni Hill and share that experience with board members. So thank you, board members, who were able to make that. And finally, last Thursday, I was able to join members of the Boulder Chamber to present to the Boulder Together investors. Boulder Together is an initiative. It's a strategic multi-year initiative of the Boulder Chamber that's really designed to address 3 areas of economic and community need: workforce housing, workforce development, workforce mobility. I had the pleasure of presenting to the group around workforce development and really highlight the partnership that we have developed with the Boulder Chamber. They've been critical partners as we work through our strategic initiative related to CTE, helping us to identify what are the essential skills that our kids need to learn as they go through and matriculate through our school system, has helped us as we begin to imagine and dream and redefine some of our career and technical education programs. I was able to share with the group some of our promising early data where we've doubled the number of industry certifications in the course of a year here in BVSD, as well as we've cut our dropout rate in half. And I attribute that to strong programming and strong opportunities that keep kids interested and engaged. So just want to thank the Boulder Chamber and for the investors in Boulder Together for allowing me to present. Was a great opportunity and just really a great partnership. So those are my comments. Board members, or Board President Marquis, if it's okay, we can move right into the COVID update, or would you like me to pause for comments on my comments, or should we continue to move forward?
Why don't you move forward and we can save our comments for later.
Very good. Yeah, sorry, that was kind of goofy. So Randy, if you'd like to bring up our deck here, board members, community members, we are excited to provide you another COVID-19 update today. As I've been sharing since this started almost a year ago, we will continue to closely monitor the data and science and do that along with our health partners. The last time that we had a meeting, we had put a pause on making an announcement in regards to what we would recommend doing moving forward for a couple of reasons. First and foremost, to make sure that the planned vaccinations went off and we were able to see those vaccines come in as we work with our partner, Boulder Community Health. Also to look at community case numbers to make sure that they were continuing on a downward trend with concern around the variant, also with the return of CU, making sure those things didn't negatively influence that data. We have great news tonight. You're going to hear from our team and then Boulder County and Broomfield Health because both areas are trending absolutely in the right direction. We'll be making a recommendation this evening. We felt like there was no more reason to wait after checking in with health partners and looking at where the data is today. So really, really excited for this presentation. So at this point, I believe I'm turning the presentation over to Dr. Crespo.
Good evening, President Marquis, members of the board. This is our weekly COVID update. And as we go on to the next slide, I will be handing it over to Stephanie Farron.
Thank you, Margaret. Thank you, Dr. Anderson. Good evening, board members. I really do have the pleasure of updating you tonight on BVSD's COVID vaccination program. As you know, we've been in partnership with Boulder Community Health, and we've had 2 very successful vaccination clinics so far. People that have come to the vaccination clinics have said it's almost like coming to a reunion. It's an opportunity to see a lot of friendly faces, folks that they haven't seen in quite a long time. They've also told us that the clinics have been extremely well run. Employees say they're organized and efficient. And as you can see from these photos, employees are really excited to get their shot. And I'll tell you a little bit more about how this process is moving along for us. So we currently have about 4,295 employees that are in regular and temporary roles. We're also working to serve substitutes and classroom monitors and others. So for ease, tonight we're rounding our number of employees up to 5,000. We're still in the process of determining the full number of employees, but as you know, people get hired and folks leave, so it's a little bit of a moving target. But we'll be updating our vaccine page moving forward with the number of staff that we have totally. So I'll speak to this a little bit more later on, but at this time, we have 100% of our staff have been given the opportunity to get a vaccine. So all 5,000 eligible employees in BVSD have been given that opportunity. Tracking those vaccines is a little bit tougher. We know that every Saturday, for the past 2 Saturdays, 1,000 employees have been vaccinated at each of the Boulder Community Health clinics. Plus, we had a little over 600 employees vaccinated through Safeway in January. We've also asked employees to self-identify if they've been vaccinated elsewhere, and so far, based on the numbers that we've gotten, we estimate that about 70% of our employees have gotten at least one vaccine. Moving forward, we'll track those vaccines by asking staff to submit their vaccination records, similarly to what we did earlier for measles, and we'll keep those on record. By having those on file, we'll be able to make sure that folks who have been fully vaccinated don't have to participate in quarantines going forward. Next slide, please. Thank you. So I want to do a very quick review of the Colorado vaccination phases. As you remember, 1B1, Group 1B1, were our moderate risk healthcare workers and first responders. Those folks were able to start getting vaccinated in January. And like I mentioned, we had about 600 people who started their vaccination process then through Safeway. In mid-January, Governor Polis announced that educators, part of the 1B.2 group, would be moved up and would be able to start being vaccinated on February 8th. At that time, the 1B.2 group only included student-facing staff. However, as you can see from this slide, we have a group 4, which are exempt staff, administrative staff, and everybody else that works for BVSD. And they've all been given the green light to get vaccinated. Boulder County Public Health actually provided confirmation to us of that on February 18th. So we're really excited that we'll be able to vaccinate everybody who works for BVSD. And I actually am going to have the opportunity to get my first vaccine this Saturday at the clinic, and I really can't wait. Like you saw in the pictures before, the staff who've gone really have expressed the sentiment that I know we all feel, the hopefulness, and this is an example of that.
The Pfizer vaccine today, so that is the one you'll be getting today. I'm really excited. I'm really excited to get this shot and hopeful for the future now that I've gotten the vaccine and now all these people are able to get their vaccine.
I'm glad I get it because I'm a teacher and I'm around kids all the time, and it makes it easier going back to school.
Very relieved and very grateful. Oh, it went great! Yay!
I mean, really quick, very efficient service. Yeah, really well.
Oh, is that real fast? I think about probably like 7 minutes. Is that real fast? I don't believe it.
It's freezing outside, but today I get vaccinated. I'm so fortunate, and so that's the thing that makes me leave the house. And everybody that comes in here, there's a sense of renewed hope for some normalcy soon, and it's just such a special thing to be a part of. You are done. Woo-hoo! Piece of cake. This is so well organized, and I'm just delighted that BVSD, made it so easy for me. So I just get my letter and, set up my appointment. It was just super easy, and it's done now. First shot done.
Went awesome. Yeah, no pain, very smooth, very professional, and just really glad to be here and finally get this.
Thank you, Randy. I've seen that video a number of times now, and I get a little choked up every time I see it. I think it really does speak to the real hopefulness and that looking forward that everybody feels, and it's really just an exciting time for all of us. So this is the timeline, the 1B.2 vaccination timeline that we presented a few weeks ago. At that time, we actually were using a 4-week dosing schedule to estimate that our student-facing staff would be fully vaccinated by April the 10th. Our vaccinations are actually ahead of schedule, and we don't often get to say that. But there's been an influx of some federal vaccine to providers such as Kaiser and Walgreens and Walmart, which provided some additional opportunities for our staff to get vaccinated, which in turn enabled us to invite more staff quicker to each of the Boulder Community Health clinics. So we anticipated offering all student-facing staff a vaccine appointment by February 27th. Instead, like I mentioned, we will have provided first dose appointments to all BVSD staff, including exempt and administrative staff. And if you recall, back in January, our initial planning had us thinking that we wouldn't even be starting vaccines for educators until after March 1st. So this is really just an amazing movement for our educators. So I really can't stress enough that this would not have been possible without the ongoing planning and coordination of our Boulder Community Health partners, and Melissa Riberty from HR and Carolyn Noe from Communications. This was truly a tremendous undertaking, and they have continued to stay on top of all the staff, all the changes, and make sure that everything has just run really more smoothly than I think any of us could have hoped for. And then finally, I really want to stress and point out that all BVSD staff should be 2 weeks post their second vaccination and have full efficacy of the vaccine by April 3rd. And that is 1 week earlier, again, than we had originally anticipated. So the next slide, which you saw, our layers of protection, is such a detailed slide that I'd asked Randy if he would cover this for us again, please.
And I do want to just second what Stephanie was saying, that we have been just so proud to work with Boulder Community Health. They've done such an amazing job and have been quick to respond as issues have come up and employees have, had a, little snafu here or whatever. They are quick to kind of add in there. So I just want to thank them for their partnership on this. It's been amazing. So as Stephanie mentioned, I was really happy to be able to reprise my role of talking about the layers of protection. As we talk about the idea of our vaccinations, this is on top of all the other protections that we already have in place. As you can see, face coverings, hand washing, distancing, the disinfecting that we're doing in the classrooms, the ventilation that we have, and those cohorts that we have the groups in. All those things that we have are important and continue to be so. Even after the situation with our vaccinations is complete, we'll still continue to ask that everybody continue to do that. But as we move to this next stage, our educators, as you see, are getting vaccinated. And additionally, we know that the majority of our 70+ community outside of our school district in the community are also vaccinated. And that, to us, gives us an additional comfort and knowledge that our most at-risk adults in the community, our teachers that are in the classroom on a daily basis, have an extra layer of protection. And Stephanie's going to talk a little bit about what our protection, our layers of protection have done for the classroom. But as we think about the vaccinations, we only believe that this will add additional protection to all in the community.
Thank you, Randy. So finally, I wanted to just mention, again, like Randy said, our students, staff, and families are really doing an incredible job of layering those protective factors on each other and on themselves. Folks aren't coming to school sick. Our mask wearing is really incredible in our classrooms. Our teachers are using seating charts. There's so many things that are going on right now that really highlight the importance and how well those layers of protection are working. We know that asymptomatic individuals with COVID are going to be in school. That's the nature of this virus. However, when we look at the data that we've collected since January, including having a less restrictive contact identification protocol, we see that in school, transmission is really incredibly small. We have only had 0.5% of quarantined individuals, that's 6 people out of over 1,100 folks who've been in quarantine since January, have actually tested positive for COVID while they've been in quarantine. And we know that some of these people have had exposures outside of school, as well as being in a classroom with a quarantined person. So again, we feel very comfortable and very confident that the measures that are happening in school, in our classes, by our staff, by our families, and our students are really being protective. And I'm going to turn our slides over now for our next steps to Margaret Crispa.
Thank you, Stephanie. And as we're sliding to the next slide, I just want to say thank you so much, Stephanie and Carolyn and Melissa and all of the members of the teams. None of this is possible without the incredible, incredible work of organizing all of this and the incredible heavy lift. And I don't know that people who aren't in it, myself included, don't understand the absolute number of hours that it has taken to get this launched. And I'm pretty steeped. So for me to say that, it's pretty incredible work. So I just want to give a huge shout out. So as we start, you've seen this screen before, and we're looking at our Back Together BVSD for our next steps. And we are ready to launch. We are anticipating that as our second round of vaccine, you can see that that date that Stephanie shared yesterday. We are ready to go for our March 30th date. There's a, some of you may not be able to see it that small, but there is a there are green letters right there. And we are happy to announce that we will be reopening our secondary 4 days a week, March 30th, because we will have all of our staff potentially having had their front facing, having had their second dose, and be ready to come back to classrooms. We are super grateful for the community support and help as we've processed this, and patience. And with that, we will be excited to have our students back. And our teachers are excited to have all our students back as we're moving into our phase 4, which is in person. So our proposed secondary transition will be for March 30th. And certainly that is dependent on all of the other components that we've talked about before, and just excited to speak about that launch. So on our next screen, we've been asked a little bit about what are our supports. So certainly we're ensuring that all of our student-facing staff have been vaccinated before the secondary return. Our goal is that we've had those vaccines available and people are making appointments. And as everybody has shared, it's been an incredible opportunity and so highly organized, and so grateful to our partners. We will continue our Monday launch as we have started from the beginning through the end of the year. When we started in the beginning of this year, we also recognize that we'll continue to look for opportunities on those Mondays. So we'll be exploring additional COVID testing. We appreciate all of the feedback that we've received on what are the components and precautions and concerns. And because of that, we'll be looking at the testing as well as continued COVID health precautions. And then additionally, we will continue our access as we have before to our protective gear, for example, our masks, wipes, and things like that. Additionally, for our students, we would like to let our community and parents know that if you have a child or if a student is not feeling comfortable attending 4 days a week in person, or would prefer to stay 2 days a week in the model, we would ask that you contact your school administration. And I will say there are a variety, with 50 plus buildings in the district, there are a variety of staffing models that we've had to use through this year. And part of that connection with our school administrators is that we want our kids to feel safe and connected to their building. We want our parents to know the supports that we have in place. And we also want to make sure that the process runs seamlessly for those options. Additionally, we will, again, continue exploring COVID testing as we move forward, as we have now. Huge shout out to the teams that are running mobile sites as well as permanent sites in the district. They're available and people are able to walk out, and we've had really great feedback about how well that process is working. And then continuing our implementation of Monday targeted support for students. I just want to say thank you for parents and community who've been working with us on this Monday targeted support. We certainly know that it was a quick launch. We're moving forward and continuing to enhance our work. We are improving every single day, and we'll hope to continue to add students as well as levels moving forward. So bear with us and keep that feedback coming. And with that, I will hand it over to Dr. Anderson.
Thank you, Dr. Crespo. And as we wrap this up, before we introduce our health partners, just again, a few thank yous in order. I want to thank our governor, Governor Jared Polis, who has provided really strong leadership for our state around support for schools with their support of the COVID check, COVID testing that we've continued to utilize, and then the prioritization of our educators to be vaccinated. You know, as I interact with superintendents that I know across the country, they're jealous. They're jealous of the support that we're getting here in Colorado. So I want to thank Governor Polis. Also, we couldn't be doing this without Boulder Community Health, who have just been just incredible partner. I know that there's been a lot of thanks, but I want to thank them as well. I want to thank our teachers. And, you know, I don't want folks in our community to forget how hard that they've been working to make this all work. This has been an incredibly challenging year. Board members, I've shared with this the hardest year in public education of our lifetime. And our educators have continuously stepped up to the plate, have continuously met the challenges, have continued to work with us, advise us. We've had great relationship, not only with just BVEA, but our Teacher Advisory Council, who has really helped guide and shape a lot of the supports to allow us to move forward together as we make these announcements. Also, thank you to our principals, Advisory Council, our leaders in buildings who have also provided great insight. I think I'm most proudest that we've continued to stay and work together throughout this pandemic. It's been challenging at times, no doubt, but we've stayed together because we all have the same goals and interests for our kids and supporting our kids and families. I also want to highlight the incredible work that our team has done over the course of the past 5 years on indoor air quality. Through taxpayers supporting our bonds, we've have updated ventilation systems. We've had a continuous partnership in regards to looking at indoor air quality with Dr. Shaughnessy, and he has advised us. With the ventilation systems that we now have in every classroom in every building, a lot of districts are following our lead on this. It has just created a really, I think, excellent opportunity for us to make sure that we're ventilating that air, and I believe is a big contributor to the fact that we're having such incredibly small spread. So I'm excited for this recommendation for our kids, our elementary, middle, and high school. All kids will have the opportunity to be in 4 days a week. Many of our kids will be in 5 days a week as we think about the other supports that we've layered on top of this, where all high school students can show up that on Mondays, have a place to work, get counseling, get supports. Our COVID catch-up supports in elementary and middle school. Many of our kids will be coming into our schools 5 days a week. And when we think that is just an incredible accomplishment. So just want to thank our team and want to now turn this presentation over to, I believe I'm turning it over to Jeff to talk a little bit about the health data and all of the things that are really allowing us to make this recommendation possible this evening. So Jeff, I'll turn it over to you.
Thanks, Rob. Much appreciated. And thanks, board members, for having me back. I'll share my screen and I'll go through the data. And I'm going to focus on really 3 different pieces here. The first piece I want to focus on is just the data update. The second one I want to focus on is a little bit of the Colorado School of Public Health projections. And then I'm going to finish with just an update on the vaccine. I won't cover all the slides that Chris covered last week. I'm just going to present the updated data so you all can see what it looks like from the last time we presented to what it looks like now. And I assume everybody can see that, but if somebody could just verify, great, thank you. So this, let me get rid of this. All of our data is looking really good. So that's the first message. The data continues to head in the correct direction. Overall, what I'll say before I even jump further than this is that overall in the state, we're continuing to see decreasing cases, decreasing hospitalizations, and decreasing deaths. Positivity rate remains good across the majority of the state. That Colorado continues to be one of the better states in terms of being able to get vaccine out. So we're doing well on all fronts that help support the plan that Rob just talked about. You can see here, this is our indicators. We are in yellow and all 3 of our indicators look good. We are at 9 days of declining or stable hospitalizations. That has been hovering around there. But when you see our hospitalizations specifically, you'll see that they're on a consistent downward trend. And this is lower than the last time that I presented. We're at 110 per 100,000 now. And our positivity is 2.9, which is in the blue. And this is the Metro data, all on a decreasing trend. Again, it has slowed a bit, so you can see there's a little more of a tail on some of these. So we are seeing some slowing trends, but the data is all headed in the correct direction. This is Boulder County's 7-day average. Again, 53.1, headed in the right direction, and a much better space to be able to case investigate and do contact tracing. And the state health department also has capacity to help local public health agencies at this point because of where cases are statewide. This is a very busy graph, but it's basically the messages that are 0 to 17, both these age categories have stayed relatively stable. They're in the lower half of this graph, continuing to look good. Again, this is our hospitalizations. You can see it's on a declining trend. There's a little bit of an up and down, but overall we are declining in terms of numbers of hospitalizations. And our deaths are also declining in Boulder County as well. This is the state hospitalizations. You can see it's on a consistent trend with our cases. And this is the reproductive number, which basically what that means is if we're below this line right here, and this is at a statewide level, if we're below this line right here, then we have decreasing cases. If we're above this line, we have increasing cases. So we've been below this line since December, and you'll hear as long as we maintain some of the same strategies that we're doing right now, we'll continue to remain below that line. And this is really the first slide that's coming from the Colorado School of Public Health. So these next several slides are coming right out of the report that they update each week now. So the next time that I present, I'll present updated data based on the projections that they're running at the time that they have the data. This is our transmission control. We're at 83%. You can see that it's been fairly steady at 80%. We did have the drop to closer down to 60% when we were in the fall. That is also the time that we had the largest increase in cases. So you can see how much this transmission control really does affect the number of cases that we'll have. And that is going to be the key theme that I continue to share with you moving forward. We'll talk a little more about that. This is the graph that's been updated as of last week from the Colorado School of Public Health. And what I want people to focus on is just the dotted lines. I'm going to talk about these 3 different scenarios. And basically this top scenario is total active cases, hospitalizations. And the scenario down here is active ICU patients. This is the threshold for ICU capacity in the state. This is the threshold for hospital capacity in the state. And this is the cumulative death projections. And the reason I'm asking you to focus on the dotted line is because that is the scenario with the increase of B117. And that is the scenario that we have in Colorado. And what this scenario predicts, and the reason we have, this looks a little different than the last one that I presented because they've updated their projections. And what they've done is they've looked at what the UK variant has done. You can see the highlight on the bottom of the slide. So they're not only predicting that it would be 50% of our total infections by mid-March in these scenarios, but they're also saying that it would be 95% of our total infections by mid-May, which is why you can see this strong increase here. The information I received from CDPHE today is around 3% of our total tests are showing up with a variant in Colorado. So we don't believe that we're going to be in this scenario, but but the Colorado School of Public Health is running these various scenarios so we can see how they might affect our numbers in all 3 of these areas. And this is the worst case at 60% transmission control. You remember that graph that I just showed you that we're about 83%. If we maintain the current trajectory of where we are right now, moving forward, you can see this dotted line on the very bottom on all of these slides. That is where we will remain in terms of these numbers, as long as we maintain that transmission control and we don't slip back. And again, I'm going to focus on that a little bit more as we go forward. This just projects based on where we are today with the assumptions that were in there before, and the assumption that things, again, vaccinations will continue at the same rate as they have been for the previous weeks. So that means if we get more vaccine more quickly, these numbers would look better. If we have more variant that comes in faster, or it has worse transmissivity, it can transmit more easily, then that would change these numbers. But you can see that in the current scenarios, we would be back to where we were in our summer rates around the 24th of March. And that's what this projects right here, this bottom line with summer rates. You're going to see me reference a number at the end. That's 1 in, I believe, 238. And the low that we had during the summer was around 1 in 779 people that were infectious in the state. So even at 1 in 238, we still have high infection, but we are better than where we were in our peak in April, and we were better than where we've been in the fall outbreak, which was significantly higher than that. We were down into 1 in double-digit numbers when we were in the peak of the outbreak in the fall. This is important because this is going to make a difference for us moving forward. And this slide's a bit old. Projections were done back in December, but it just reaffirms again the importance of masks. And masks in transmission control can make a significant difference. So in addition to washing hands, in addition to doing the things that you saw that Margot talked about on the slides, it's really important to look at masks because masks can have a significant difference. This is projected daily infections and projected daily deaths. What I want you to focus on is just the purple line that shows that masks can have a significant impact. Even as vaccine is getting out into the community, masks can have a significant impact on preventing infections and preventing deaths as we move forward. So it's just really important to, again, focus on and think about the importance of these strategies going forward, like masking, like making sure that when kids are in school that they're wearing masks, that the schools have good ventilation, all those things that the schools have been focused on from the very beginning is going to help us make sure we maintain low counts in all these areas. And I'm going to go to the vaccine distribution now. So this is just a reminder that we're still in phase 1A, 1B1, and 1B2. The state is anticipating that we will move to start phase 1B3 sometime in the early part of March. We expect that they'll make an announcement associated with that, but we are still focused on this section right here. I'm going to show you some data on how we're doing relative to that. Total number of vaccines, this was as of February 20th, is at almost 50,000 in Boulder County. 25 of those, first dose, 24,000 of those people have had both doses. This is the number of vaccines that we're getting out on a daily basis. That number continues to go up and down, but in general increases. Just a reminder, we have 32 providers in the community. We have the ability to provide 22,000 vaccines a week with our current capacity, and we still are only getting between 7,000 and 8,000 total vaccines in Boulder County a week. So we have capacity to do a lot more than we're currently doing right now. And we are doing really well in terms of vaccinating our most susceptible age groups, which is 70 and older. We know that 78% of the deaths across the state come from this age group. Boulder County is the red line here. Broomfield is the green line. Both Broomfield and Boulder are doing really well. We're at nearly 80% of our 70-plus-year-olds, so doing really well at making sure that the people who are going to be most impacted by this disease are getting vaccine. And this is the last slide again. 1 in 236 people in Colorado are infectious as of the 8th of February. This is probably lower now because infections have continued to decrease. They'll do another update this week, but they're predicting on the previous 2 weeks when they do that update. So it's always going to be a little bit backdated and won't be current as of the current day. Again, many people don't know that they have the virus, and it's really important to get tested. It's free, it's easy. As I've said before, you can just go to our website, Boulder County Public Health COVID-19, click on testing, and it has the locations of where that free testing is and the hours. You don't have to have symptoms. So please take advantage of it because we want people to know if they're positive or if they're not. And again, it's preventable, wearing masks, washing hands, social distancing. I've talked about the exposure app. I'm sure people have heard this multiple times, but the exposure app allows you to get notified when you've come in close contact with somebody who's a known positive, and it sends you instructions of what to do next. And as we've already heard, the great news is that we're continuing to distribute vaccines. We know it's slower than what people would like, and the only limitation on our part is the ability to get more vaccines. As you heard, we have capacity to do a lot more. We also have set up backup plans for when we do have a lot more vaccine to be able to do more large clinics as well as small clinics and pop-up clinics around the county. So we are ready when the vaccine comes, and we're doing everything we can to make sure that we're getting what we have out there, and it's working well. And just keep up the good work. If we can maintain keeping these prevention strategies in place, we're going to be in good shape moving forward, and it'll help us make sure that our kids can stay in school. That's all I have, Rob.
Thank you, Jeff. Helene, did you have slides to present today as well?
Sure, yes, I will.
Thank you.
Everybody, thanks for having us again, and nice to see everybody again. So just to, I know some of the things have already been shared, so I won't repeat everything again, but in terms of the dial updates and in terms of where Broomfield County is, we're actually now in level blue. And so that's good news. We continue to see a decline in our cases, our case rates and positivity rate and our hospitalizations. So that is all good news. But with that said, we still have cases and we still see some pockets of concern. And I'll highlight some of those things as we go along. Our 7-day positivity rate is, like I said, under 3%, and kind of have been hovering in the 2.7, 2.8, 2.9 over the last couple weeks. So we are happy to see that, and that puts us in that blue level. And same with our case incidence rates as well, in terms of seeing that number much lower than it used to be just a couple months ago. So 72 cases out of 100,000. So again, another slight decline as well, and having us fall into that blue level. Just as a really quick, just FYI, in terms of things that are different in level blue, this is just a snapshot. There at the end of the slide deck is just extra information if you'd like it. But in terms of personal gatherings, 10 people in 2 households, restaurants being able to be at 50% capacity, up to 175 people indoors, and 225 for larger venues, and last call shifting to midnight, as well as just a few other events that capacity size changes, which I know relates to some of the things that we talk about with our school partners and other events as we move forward into thinking about spring and so on. And then just some other general updates to share, just kind of trends and just interesting points. We are continuing to watch for the different variants, and in terms of the B117, in terms of seeing, as of last time we had updated this 86 cases, and just being aware of 3 cases in Broomfield County. And CDC definitely is, predicting that this will be more likely 50% or more of the variants circulating in the US by mid-March. So while we have our rates improving, we do want to still be vigilant, just as Jeff just shared, in terms of mask wearing, distancing, all of the things, hand washing that we've been saying all along, stay home if you're sick, all of those, as well as all the vaccine efforts that are happening, help all the layering. So in terms of other things just to be aware of, our testing, we also still have access to testing, and still encourage that, because a lot of people can be symptomatic. And then just an awareness of some outbreaks that we have in Broomfield County. One was with a child care center, one's with an elementary school, and one is with a wrestling team. And so just, again, that awareness of how important it is to get tested, possibly if you're exposed or sick, so that we can quickly, quarantine and try to reduce the spread of the virus. And then shifting gears just to kind of our general updates of our vaccine. We are all, chugging along. Last week was a little bit harder with the weather, and that complicated getting vaccines in, but we have continued to work through our age 70 and older, or 1B1, and are just starting to kind of dabble in our 1B2 of 65 to 69 and older, and as well as making great progress with our child care centers and our educators, and hope to be closer to having them all vaccinated as well within the next week or so. So that's good news to share across the front, and over 17,800 doses have been administered to Broomfield residents, and all of our long-term care facilities have all completed their vaccinations as well. As Jeff highlighted, we have about 78% of our 70 and older vaccinated, which is again the highest risk age groups, and we are still finding other individuals 80 and over. So we always want to make a priority in terms of that highest risk with the death rate. And we are making great progress with our 65 to 69-year-olds, where about 43% have received their first dose. And this is just a visual of kind of how the state is doing in terms of different counties in terms of vaccines administered per 100,000. So we're feeling really good with as we're moving along, and are excited to get more vaccines, just as Boulder County mentioned, having the capacity but just needing more of the supply. And just a little bit of just FYI updates from the federal level. Johnson & Johnson is expected to be reviewed by the FDA very soon. And just as an additional information, the federal allocations program, which has initially with Kroger, King Soopers, Walmart, has also expanded to Walgreens and Safeway. So we are all very excited and hopeful of having much more vaccine coming into the state, and to as these next couple of weeks as we kind of ramp up more. And as I said already, weather patterns definitely caused a bit of a glitch for us all last week, and I know caused some cancellations for different events, but we are quickly ramping up again this week, and looking forward to moving into phase 1B3, which we're hopeful kind of that second week in March to be able to start moving that into the next phase. And this is just our information on our website in terms of just broomfield.org/COVID. Thank you all. I'll stop sharing.
Thank you, Helene. Again, thank you, Jeff. At this point, we're happy to open up for questions. Tina, unless Dr. Urbina had anything else to share, or Jeff, you had anything else to share before questions?
Dr. Anderson, no, I'll wait for the questions. Thank you.
Great. All right. Shall we start with Richard?
Well, that was a great presentation, great news. I really appreciate that. I only have one question, and it has to do with graduation ceremonies. Will this new information change that a little bit in terms of what's been planned?
I can talk a little bit about that, but graduation ceremonies as of right now are following indoor and outdoor event guidance. So we are encouraging school districts to plan for that, and recognizing that there might be changes between now and graduation. But the yellow dial spot on the dial is where we currently are.
I'm thinking more about our own graduation plans that we have already been informed on. Is that changing, Dr. Anderson?
So I'll let Dr. Crespo add in any other anything else other than as cases go down, and as Taylor shared, some of the guidance is lifted. It's based on community cases, right? At this point, we're planning to have all of our events outside, which allows us to have more people there and maximize the number of individuals that can attend. And this is something that we'll continue to watch. I think that, as we announced graduation ceremonies last week, it was important for us to set those dates and have plans, because we know for many of our families, they need that advanced planning. Again, as cases go down, then we would be able to open that up to more individuals, following the guidance of both Broomfield and Boulder Public Health. I didn't know, Margaret, if you had anything else that you wanted to add there. Okay.
So does that mean that all high schools will be going to Boulder High still, or is that just the one venue graduation?
No, we've given schools some flexibility in the venues that they chose, and so schools have the opportunity to select those. And so at this point, we have several schools most schools are going to Boulder High. A few schools have chosen not to do that. But the cases has nothing really to do with changing those venues.
Thank you. So it's school by school then, that they make their own decision in terms of what venue they want to use?
We did provide schools flexibility. I will say that we received a lot of great feedback on the events that we held last year. I think a lot of schools are very excited to be able to go to Boulder High, which is where the majority of our graduations will be held. But we did provide schools flexibility.
Thank you.
Okay, Kathy.
Thanks, everyone. Again, outstanding presentation and very informative. I just have a couple questions. So I don't think that we can safely say that as we go back to school, we're going to have no cases. So I'm wondering what the new quarantine requirements are going to be when we have less social distancing and more kids in the school. What is that going to look like for our requirements for going forward if a student should come down with positive?
I can take this, and then public health, if you'd like to chime in, that'd be great. You know, right now our CDPHE case and outbreak guidance has not changed, so we would continue to follow those same regulations and guidelines. The use of seating charts and being able to target our contact identification has really helped us. And even if folks are sitting closer than 6 feet, we will still be able to look at individually who is around that person and identify those people instead of putting out an entire group. As long as masking is, is being maintained and is effective, and all the other protective factors are in place, then we'll be able to continue the same sort of quarantining that we do now.
But it could potentially impact more students since we're putting more in a classroom.
Of course, yeah.
But teachers, if they're vaccinated, will not need to be quarantined, right?
As long as teachers are 2 weeks past their second dose, then they will likely not need to be quarantined, right? I'm assuming that there could potentially be situations that come up where we might ask somebody, but at this point, the recommendation is that they would not have to.
And my understanding is we're able to move forward as we are because our community numbers are looking really good. And I think that was one of the things the CDC talked about. Is there a threshold or some kind of point where we would have to reevaluate if the community numbers were to turn around? I think that's my biggest fear, is that we go forward with this and then all of a sudden we have to backtrack.
Well, I think that's been all of our biggest fear, Kathy, right? Like, I think that's why we've been cautious in making this announcement. And I'll let Jeff or Dr. Urbina answer this. I will say this, that we'll continue, we're going to continue to stay in contact. If we see things, change and switching the other way, depending whether that's the variant or not, we certainly reserve the right to make different decisions to make sure that we're keeping our community and kids safe. We do not believe that is going to be the case with the number of vaccines where the community cases are. That's why we feel confident in making this decision today. I don't know, Jeff or Dr. Urbina, if you wanted to add to that.
Yeah, I'm happy to start, and then Dr. Urbina can jump in as well. So there isn't a specific number that would do that, Kathy, but we are feeling very comfortable about where we are because we already know with the kids that we have in school that we're not seeing much transmission. We know there's a little bit higher chance for sure when you bring in middle and high schoolers. So you should expect to see more cases. I don't want to not be upfront about that. We would expect to see more cases, but we still don't expect to see significant transmission from kids to teachers, and we vaccinated teachers. So we feel like we are moving in the right direction. And there may be some more students that are positive, but again, the numbers of transmitting from students to adults is lower than it is in the general population. So I'm certainly comfortable with the decision to move this forward at this point. If we had a significant explosion of the variant, then we would be talking again because that could change things. But that's not what we're seeing at this point, and we know that there's more benefit to having kids in now. You saw the horrific data that we presented a couple meetings ago with behavioral health issues, and we know that those things are continuing and the kids do need to be back in school. So Dr. Urbina, do you have anything else to add?
Yeah, this just gives me an opportunity to thank Dr. Anderson, Dr. Crespo, and the entire team for doing such a good job of putting prevention strategies in place. And I think that's That's what's reassuring to me, Kathy, is that by putting the prevention strategies in place, by having, and those continue, and then having teachers vaccinated, and then the cases going down in the community, along with more vaccinations in the community, and hopefully the transmission factors that Jeff talked about in terms of physical distancing, hand washing, the social gathering, are all going to hopefully line up and the stars are going to be in place that will have less transmission both in the schools and the community, that we won't have that explosion that we're all afraid of with the variants. But I think that's the issue, is we still have to have all of these things in place to make this work. And so it just gives me a chance to say thanks to Boulder Valley School District and the incredible staff that have done such a great job of making our schools and helpful being in our community safer for everyone.
Well, so I echo that thanks, but also to you, Dr. Urbina, and to Jeff and to Helene for sticking with us and being here all the time. And unfortunately, or fortunately, because I learn a lot listening to you, I think we'll still be having you at our meetings for the foreseeable future. And that's, our community is not getting vaccinated at the rate of our teachers, which is why I asked, because the CDC, I thought, was talking about looking at our community and schools in terms of the community, and hopefully we won't see that explosion. So, and I know that there's not a number. I was just kind of trying to get a sense of what we would be looking for as something that would cause us some concern.
Sure, and as Jeff and Helene both mentioned, if we're ready to go with vaccines. When we get more vaccines, that's not going to be the issue. People are ready, and so I think as those get rolled out, and you see what's happening at the national level, nobody's to blame. We just need to get people the right jab, as they say in the.
Well, thank you so much, everyone. This is really exciting news, and I just have a quick question for Rob. So for those students, or maybe Margaret, who want to stay for 2 days, you said talk to your administrators, so that's going to be handled on a school-by-school basis. Can you just talk a little bit about that?
Sure, absolutely. I can take that question. So we anticipate, similarly with as when the elementaries came back 4 days, that the principals work very closely with the families, because there are a number of reasons why a family may choose. Initially, I only want 2 days because I've got concerns, or I'm not comfortable, or I have questions. And some of those can be addressed directly with the principal, knowing their building, the specifics around what their schedule looks like and what the spacing is. For us to try, those of us at the district to try to make those decisions would really be unfair to the building as well as to the leadership that we have in the buildings. Additionally, if through those conversations they say, well, I'm still not comfortable, there are some considerations that need to be made for how classes roll, what that would look like for high flex versus kids in person and at home. And we certainly know that the principal would work with the teacher to make sure that the impact doesn't impact the rest of the class, as well as the ability for the teacher to be able to do the work. So that's really the reason why we're not comfortable making a blanket statement for so many buildings and are asking them to reach out. And then certainly we're always available through that process.
Yeah, the flexibility is important, but I think it also sounds a little overwhelming. So anyway, thanks for trying to make that work for as many families as possible. That's all I have, Tina.
Okay, Donna?
Yeah, thank you everybody for the presentation. And I think parents are doing a happy dance tonight to hear this news. I think it's great. It makes me think of other scientific ventures that the whole world has been on. And, just the big step that we took, and not to paraphrase the famous quote, it's a small step for our district, but it's a giant leap for our students, our parents, and our community. They've come together, and because of their persistence in following the protocols, we're able to move forward. But I had a couple of questions. One is, I spoke with a teacher recently about the hall passing with just the 2 days, the half schedule, and my question is very similar to Kathy's. What I want to know is, have we thought about protocols in those hall passing? Because I know teachers are saying it's great in the classroom. The kids are distanced. They're following all the rules. But as soon as they're out there in these little groups huddled and talking, and that's what kids want to do. That's what our secondary students want to do. Have we developed because the same thing that Kathy brought up, you can see where someone that could get it could pass through the hall with hundreds of kids. So it's hard to quarantine who's ever come in contact or to follow that, to do the contact tracing. So my question is there any protocol for that hall passing gathering time?
So I can answer and then kick it off to Stephanie for some more specifics if needed. So I would say that all of our buildings have pretty strict protocols, and having been in a couple of buildings through this process, they're especially elementary and middle, they're very clear on like where they want them to walk in the hallway and what that looks like and what the directions are. Additionally, I mean, Donna, having been in a classroom, right, like it's really hard once they're out in the hallways and certainly hear teachers' concerns. And what I would say is the amount of time that they're passing in the hallways is pretty limited. They are still moving from classes, so they're not having that very direct, in most cases, because I'm going to say it and then somebody's going to say something else. In those cases, they're not having that direct interaction. And certainly a concern that if the teacher has that concern or something's happening in a building, certainly reach out to the principal, because it may just be like, a bottleneck in one spot, or it may just be a grouping conversation that's specific to the building that we can certainly address. We've had a lot of luck. Our food services staff and our facilities and operations individuals have been so helpful going out to buildings, and Stephanie has also gone out to buildings to say, oh, there's a bottleneck here. What are the ways that we can do to address that? They are certainly willing to do the same work as we're bringing all of the students back 4 days. So absolutely reaching out to their principal and getting that support would be great.
The only thing that I would, the only thing that I would add is that, especially at the secondary level, we are able to do a lot of interviewing with the students themselves or the staff person, and really ask them, who do you spend time with? Who do you have lunch with? Who do you walk to school with or carpool or something like that, so that we can narrow some of that, that targeted tracing down as well, because usually what we've seen is that time in the hallway is not that long, like Margaret said.
And then just one other point, Donna, and just to remind the board and the community, why this is so complicated. We had to make decisions in July for today, right? So as a reminder, we have middle school students are only taking 3 courses at a time. High schools are on block schedules to limit that passing time. I think all of that plays into making this a more secure environment, trying to limit the exposure for kids. When we developed our 5-phase plan, we really tried to develop that for all 5 phases. And so I would say that, some of that may have gotten lost. I just want to remind the community as we think about why are we on block schedule? Why do middle schools only have 3 periods? That, with the cohorting and the limiting of the passing time, really set us up for success almost 8 months later, where we are here now, where there's going to be less of that than you would see in a traditional schedule in a traditional high school, middle school.
Okay, also I have a question about transportation. With some of the RTD routes getting cut, especially from parents I know in the Heatherwood area, is Boulder Valley considering how the secondary students, some of them can get that transportation they need to the high schools?
Donna, we've been working closely with RTD, and right now, sorry about that, we're looking at setting up a shuttle in that area that will take those students over to an RTD stop where they can then take the RTD bus to Boulder High and Fairview.
Wow, good to hear. Good to hear. I have one last question on the tests, and maybe Jeff or Chris, you could answer this. Have our test levels stayed about the same with people going in to get tests? Are we seeing we're having the same number of tests? Is that dropping way off at the different sites that we have?
Taylor, do you have, or Soda or anybody on the phone have that information? If not, I can pull a graph and answer it after this.
Yeah, I have some testing information I can pull up real fast.
Our average tests per day has decreased a little bit to 1,900 tests per day. And our average positivity has been steady and has been under 5% for quite a number of weeks. So it's 3.4%. So our testing is reasonable and steady, and our rates are low.
Okay, thank you.
Okay, Kitty.
Well, most of my questions got answered because Kathleen and Donna so graciously asked my questions for me. So the only other thing I just want to say is that I'm sure that the parents will be impressing upon their students how important it is for them to follow the rules so they can stay in school. Because one of my big concerns was, the passing period piece of it. So that's all I have, and thank everybody for all the work you do and the great presentations you give us every single time.
Okay, Lisa.
Thank you. I think I only have one question left, and it's for Rob. Thinking about how it's the time of year when our kids head to school in parkas and snow boots, and then by 2 o'clock there's 7 layers on the ground and they're running around in t-shirts and shorts. I'm wondering what plans we might have for using our outdoor spaces more effectively, given this 4-day a week and the 3 feet and sort of the concerns that might still exist in middle school and high school.
I'm going to ask Rob. It's great that you asked that question. We actually had a weekly wake up this Monday at 7 a.m. to talking with our educators on how do we begin to leverage some of our outdoor spaces. We have such great expertise in our district on how to leverage outdoor learning. And so, Rob, you want to maybe highlight a couple things that I know that Carol's been working on?
Yeah, we had a weekly wake up that Randy leads, Lisa, on Monday at 7. If you haven't had a chance to watch it, it will inspire you to be outside. We had some speakers from Boulder County, from Thorne, some of our own teachers that are really using the outdoors to our benefit. So we are attempting to give all of our teachers the tools to be outside and encourage them to do so. So as it gets nicer, I think, as you would know, we've been constrained a little bit, especially this past week when we had temperatures below 0. But right now, it's really just making sure everyone has the tools to be outside. There is a little bit of a challenge always when we have high flex learning going on, of course. But even I know our team is working closely with Andrew Moore and his team to see, how would that work, et cetera. So, but a lot of great discussion going around there. And I know a lot of teachers are already taking advantage of the outdoors.
Okay, thanks. That's good to hear. I'm sure I'll see lots of pictures from Randy with some outdoor spaces when he gets them going. I think that's it. I'm excited to hear this news. I know we've all been waiting for a day we can have this conversation. So looking forward to getting our kids back. Thank you.
Okay, Stacy.
Yeah, thanks for the presentation and for all the great information. And that's great news that our students can get back. My question is similar to the option to go 2 days. And that is, I know currently there are some students who on any given day, just as a one-off, don't feel comfortable going, and they'll call the attendance line and say that, they're going to be virtual that day. I'm assuming that policy will still remain as we go forward.
So we are still working on how to manage that conversation, because it is much easier when our students come in. We do understand that if they're failing the screener, if there are other factors that are going on, and we certainly want them to be comfortable, but we are trying to come up with levels of parameters that make it flexible, and at the same time have the expectation of attendance in school as much as possible. So more to come on that.
Okay. And I would just add, board members, that this working with kids, teachers teaching both online and in person, is why it's critical we keep Mondays as an asynchronous learning day. I know that there are lots of folks who would want us to be in person 5 days a week. We have to preserve that time for our teachers so they can make sure the adjustments and planning to meet the needs of all of our kids. As a reminder, today, only we have 1 in 4 kids in elementary and middle school is 100% online, and in high school, that's closer to 1 in 3. And so those are really tough challenges that we're putting our teachers up against, and that's why I'm so grateful, and every chance I get, I'm just so thankful for all the work that they're doing. And it's why it's critical that those Mondays have to stay as asynchronous learning days to provide that planning, training, those opportunities for teachers to get prepared for the week to provide high quality instruction, regardless of a parent or family situation, right? Whether they're learning online or learning in person. I don't want it. It is an incredible challenge. And it's why, as we move forward next year, we've rolled out BU Link, really working to get out of the high flex business and moving those kids who need that online experience more to more of a traditional online synchronous school. That's BU Link. But I just wanted to reiterate how critical that those Mondays are for our teachers. We've heard it time and time again. We're up for the challenge. We're willing to do whatever we can to serve our kids and families, but please make sure that you keep those Mondays asynchronous to give us the space and time to do this really tough work.
Tina, I have one more quick question, if that's all right.
Sure.
So I'm hearing that the COVID check that we're running out of our schools, Rob, that the results are taking a lot longer than they used to, up to 4 and 5 days. Have you heard that? And is there a problem with the labs or something going on? Because I know that delayed results is not what we want.
Kathy, if you don't mind, I can take that. Right now, we're averaging just a little over 30 hours to get results. We had 3 days when we had the really cold temperatures where we experienced some delays, but other than that, we're right around 30 hours.
Okay.
Oh, and Rob, can I just add the delay was for the swab tests that were being handled through the Centaurus community site. We have not had any delays in our saliva tests, which are operated through the mobile sites.
Okay. I had a couple of questions. I just to echo all the work the teachers are doing, this is yet another transition, and they'll need to reestablish seating charts and also get an idea of how many people are actually going to show up and what that looks like. How are we going to help teachers prepare for this before the first day of that of the 4-day a week?
So I can take that one. We actually are looking at calendars, as this is happening, transitioning right now. We're looking at calendars to make the most flexible Monday available so that we've got some prep time for them to set up their classrooms. And that indicates for us that we have to make some changes in some of our current plans district-wide and at the school level to provide that time. So it's competing, just making sure they've got the time and providing it before similar to how we did it with the elementary group, before the students come back in March.
Okay. And then for those students that are currently 2 days a week, and that's really all they're comfortable with, and who are at risk, and they feel that they need to go to 0 days a week, what extra supports can we offer them? Because that's a really big transition at the end of the year, after being in for 2 days.
So what I would recommend is that they definitely contact their principal so that their principal is aware and can work with the teacher team to figure out what's the best strategy. And then certainly throughout the district, as we provided in the very beginning of the pandemic, we have network teams that are available to provide that support so that students can have the best experience possible in their 4-day at-home transition. And again, principal is the first contact, and then the principal will reach out to their network support teams.
Okay. And then my guess is we'll get some questions about what extracurricular will look like in the 4-day a week, and how does that impact it. I think both the Colorado Department of Health and the CDC both encourage us to limit those activities to preserve the academic environment at this time, acknowledging that that's often the best part of the day is your extracurricular. What is our communication right now to our community teachers and staff?
So at this point, we have not communicated anything related to extracurricular components. Our goal would be that over the next couple of days, as we continue to finalize our plans, working with those partners to make sure that we're following the guidelines, that we're not negating any of the work that's been done to keep kids in school, and then we'll be sending out communication shortly around what those extracurricular pieces look like, any modifications to what that may entail as we move forward, similar to the discussion around graduation and other activities like that, we want to make sure we're still staying in line before we communicate ahead.
Okay. And I have heard of some athletics outbreaks across the state from other board members. So I just want to make sure we know that that is happening. We seem to be doing pretty well, but it is having an impact from what I can tell. Any other questions that have come to anyone's mind? If not, I just want to, of course, with everyone else, thank our public health partners from Broomfield and from Boulder. And we continue our journey together in this pandemic. All right. So our next item is public participation. So our public participation continues to be virtual. So if you wanted to participate, you needed to contact Laura Schaefer, the board secretary, by noon on the day of the board meeting. And then you'll be signed up and you'll be instructed on how to enter the waiting room, where you'll be called when your time is up. So we recognize the value of public comment on issues related to the operation of the schools. We ask you to confine your comments to matters that are germane to the business of the school district. We'll start with members on agenda items and then move to people speaking to non-agenda items. Please limit your participation to 2 minutes. If you go over 2 minutes, you'll be cut off. And just so that you can keep your timing, you'll see a yellow card at 30 seconds remaining. At 10 seconds, you'll have an orange card. There we go, great demonstration. And then you'll see a red card at the end, and then we'll turn off your microphone. So that's about it. Again, we have a short list tonight. So speaking on agenda items, we'll start with Chris Nelson.
Am I good, Laura?
We can hear you.
Yep, you're good.
You are, and you have 4 minutes. Thank you. Hello, I have a sophomore and 8th grader in BVSD. As most of you would expect, I had intended to talk about the lack of a return plan for BVSD compared to the full-time school plans all of our neighboring districts have announced, as well as the dial metrics for each of those counties compared to Boulder and Broomfield. As previously noted, Broomfield moved to blue yesterday. Following the announcement earlier tonight of returning on March 30th, I want to say thank you to a group who was overlooked earlier in the meeting. Thank you to the hundreds of parents and caregivers who have continued to advocate since August 2020 for the choice of full-time in-person school. I am aware of several hundreds of emails sent to the district related to this topic over the past several weeks. Many of these emails were from families outside of our advocacy group and came from teachers, physicians, and mental health professionals. The consistent message in these emails was that the lack of action was truly disheartening, skittish, and inexcusable. More importantly, the replies to these emails, if you were fortunate enough to receive one, were defensive, hollow, inconsistent, and showed no sense of urgency. They included, "Our schools are open," and "Thanks again for reaching out," and "BVSD, in fact, offered in-person for secondary sooner than other districts this semester." Please note this is actually not true and has nothing to do with future full-time learning options. There was also a petition supporting full-time school with almost 1,000 community supporters. We know what is right for our students, and despite the district never once engaging students, parents, or their communities by survey or community meetings as other districts have, I am thrilled that the district has finally listened to parents and made the right decision for all students who want the option of full-time school in a classroom. The district also needs to allow the community to listen to teacher negotiations, which begin on March 1. The district is considering hosting these in person, which will limit the number of attendees. It is imperative that the public be able to watch these negotiations. I would also like to highlight the local teachers union, BVEA's donations to current BVSD school board members. According to public data, 4 of 7 current board members received campaign donations averaging just over $2,600 each. Those members are Kathy Gebhardt, Tina Marquez, Lisa Sweeney Moran, and Kitty Sargent. Significantly, Ms. Gebhardt and Ms. Marquez received and accepted those donations for elections in which they were running unopposed. In addition, these donations made up between 25% to 100% of the total donations each of those members received for their campaigns. As a concerned parent, I can't help but wonder what influence the teachers union has had on recent decisions or lack thereof, particularly with Monday remaining a full planning day. I request that any board member who received more than 50% of their campaign funding from the union recuse themselves from negotiations due to conflict of interest. Thank you.
Okay, our next speaker is Lisa Hall. Lisa?
Lisa, it looks like you're muted. Lisa, if you can hear us, it's still showing you're muted. President Marquez, we may want to move on to the next speaker and come back.
Okie doke. Sean Howe.
Sean.
Not speaking.
What's that?
Sean withdrew her name from the list.
Okay. And then Julie has withdrawn as well?
That's correct.
Okay. Heather Middleton?
Hi, my name is Heather Middleton, and I'm speaking on behalf of myself and 20 of my friends who have kids in BVSD schools and who want all kids back in school 5 days a week. I have 3 kids, 2 are in BVSD, 1 at Fairview and another at Summit, and my 3rd is in a private school. They've been in school since the beginning of the year with no closings. And it just so happened I had my son's middle school teacher conferences today. I didn't even have to ask how they felt about this issue. All of them expressed in our one-on-one meeting they wanted the kids back full-time in school. They also said about my son that they saw huge improvement in participation, understanding of material and assignments, being engaged in test scores since he has been back 2 days a week, and just recently 3 days. But most importantly, they mentioned his happiness has increased as well as all of the kids that are back in school. This echoes what my friends have experienced too, as you demonstrated in your slides, and the cases will still happen, but deaths and hospitalizations rates have fallen off a cliff. We can't continually operate like it was a year ago or even a few months ago. We have knowledge, testing, therapies, homeopathic, and now the vaccine to make what was once a deadly illness to a manageable one. For the few who do have immune compromised systems or family at risk, PBSD has a fully functioning online system for them now. There are no more excuses. It seems crystal clear. Kids, parents, and teachers, even today.
Okay. Kim Jager.
Hi, this is Kim Yeager, and I have a student at Broomfield High School. While the news on today's call is moving in the right direction, this board could take a big page out of Adam's 12th playbook. The leadership of Chris Godowski has been exactly what parents in BVSD have been pleading for. They've been transparent, communicative, and had a plan of attack ready to go. None of this "we'll get together to plan to have a plan" nonsense. And as a result, they're going to be opening sooner than BVSD. BVSD leadership never indicated that they were making a priority or showed any sense of urgency. There was no transparency, which left parents in this district scratching their heads and wondering why our district is unable to emulate what's happening in the districts all around us. They've lost sports, they've lost high school experiences, and they're struggling mentally. I've held the hands of a friend whose child has overdosed as they searched for treatment, hugged another whose child attempted suicide, and consoled yet another who, thank goodness, stumbled upon their child's suicide plan. They won't come and talk at a district meeting because they don't want to expose their children. They're trying to piece their kids' lives back together. I'm here speaking for them. It's not made up. It's happening in your district under your leadership. You might not have had a student commit suicide, but make no mistake, families suffered. BVSD kids lost hope, felt forgotten, and it's been the parents picking up the pieces. We get 4 days, March 30th, mediocre response, but you've set that bar all year long.
Okay, Julia Vandenover.
Hi, my name is Julia Vandenover. I have a 8th grader at Casey Middle School and a 6th grader at Platt Choice, and I have been very unimpressed on the connection back to IEP students. My son has an IEP. He operates in the bottom 12% of his class. He has all his life, and I'm wondering what the district is going to do to help him catch up. The first quarter, he had no IEP minutes due to the school, so he lost 1,000 IEP minutes. And the second and third quarter of this year, he received, he's supposed to be receiving 200 minutes, and he received way less. So he's already at a deficit, and now he's even at a bigger deficit. And I feel I have not heard from the district what the plan is to catch IEP students up or to catch up regular students who are also at a deficit. My 8th grader is going into Boulder High, only having 63 days of math, 63 days of LA, 63 days of science. And she's supposed to be fully functioning as a completed 8th grade student, and she's not. And how is the district going to be catching up all these students? What plans are in place? Because when you have a kid who has a learning disability and is operating on the 12% of the classroom, they need more support. It's not just special ed. He needs so much more because he's dyslexic. So I would like to see a plan in place and strict guidelines of how you're going to catch all these students up for all this lost time this past year. Thank you.
Okay, and is Lisa Hall back? Is she able to speak?
I think so. I'm letting her have access now.
Okay.
Hi, can you hear me?
Yes.
Hi, yesterday I met with Dr. Pamela Swanson, the superintendent of Westminster Schools, to learn about their COVID success in having all grades full-time in person 5 days a week since August 20th, except Thanksgiving till January 6th. Their largest high school of 2,200 students operates 5 days a week in person with morning and afternoon cohorts. Teens are happy to be in school with an 80% in-person rate for all high schools. There is no hybrid. I, and likely the 1,000 others who signed the change.org petition to get BVSD secondary kids back in school, am relieved to see you finally getting on board with all of the other districts and what they're doing. But we have another 5 weeks sitting at home waiting to return. At this point, it's hard to believe this is necessary. Might you evolve your plan a step further to return seniors sooner for all grades by March 15th, like surrounding districts? A transition at fourth quarter is easiest on teachers. Did you get any input from our high school teachers directly? Many wonder at this point in the pandemic whether teachers still need an entire school day out of a regular 5-day school week for planning, and extending the school year just a few weeks seems warranted. Westminster is collaborating with its stakeholders about it now and finding overwhelming parent support. BVSD work more collaboratively with all of us rather than having a few of you at the top making decisions behind closed doors. I thank the parents and professionals who've advocated for secondary students. Thank you, BVSD, for finally stepping up. I thank the kids also who had the courage themselves at public comment over the months. Let's do better involving these young adults and parents from here forward. into the decisions that impact them.
Okay, and then on non-agenda items, we have Lisa Larson.
Lisa.
Hi, I'm Lisa Larson, and I'm a multi-intensive paraeducator and the current president of BVPA, the Paraeducator Association. I wanted to thank the board for everything that you've done over the past year and all the hard work. I've been awed at the amount of balancing it takes in order to meet the needs of the staff, the students, the families, and the community. I appreciate all you've done, so thank you. I also want to thank the extraordinary vaccine rollout that has happened and has gone so smoothly. Thank you for that. And finally, I really want to thank the paras out there across the district. They've been incredibly flexible and dedicated. They've worked online, in person, in workrooms, in classrooms, outdoors, in health rooms, and they've supported the students with kindness and compassion. And they do this work because they care. So thank you to the board, thank you to the paras, thank you to the vaccine rollout, and to everybody working so hard to keep this going. Thanks.
Okay, so our next item is board communication. And if we could, we can start with Richard, if you have anything.
Just one thing, I did tour Uni Hill yesterday, and it was a great site that I saw in terms of the big cafeteria that they have now versus what they used to have. The extra space they have downstairs in terms of the classroom, the new playground. Ina was delighted, you know, I mean, she was very enthusiastic in terms of the way she expressed her appreciation. And then we went over to the primary building and saw the plans that are in the making in terms of making that place a little bit more suitable than what it is now. So thank you, Rod. Thanks, Margaret. Thank you, Rob Price, and the rest of the team there for taking us on that tour. It was wonderful.
Okay, Kathy.
Yeah, I just want to thank everyone for coming forward. As always, we really enjoy hearing from the public, and I just have two quick things to share. I was able to participate in the Southern Hills National History Day judging last week, and as always, I walked away really amazed at the quality of the work by all of the students, even in a pandemic. I know that this was not the best of circumstances for putting together your NHD project, and heard stories from students about how they really were nervous about it, and then they just came through and they were just shining examples of the potential of what we can do even during a pandemic. And thanks to the teachers and to the administrators and to the community who all stepped forward to help judge this. We had to do it over a course of 2 days because we did it all remotely and on Zoom, and I think it actually worked pretty well. So anyway, it was just nice to get a glimpse of what's been going on in at least one school and with our students, and so I really appreciated having that opportunity. And I wanted to do a special thanks to Lisa Larson for her kind words. I know that the paraprofessionals have been really on the front line of a lot of what we've been trying to get through in this pandemic, working with some of our highest needs kids. And so I really appreciated her positive message, and I hope we can continue to work together as we go forward, because it's that kind of collaboration that I think is going to get us through to the finish line. So thank you so much for stepping up and for representing your paraprofessionals and for all that you're doing for them. That's all I have.
Okay, Donna.
Yeah, thank you for everyone coming forward. As I heard people talking tonight and parents talking, I thought about the landing on Mars with the name of the rover, Perseverance. And I think our whole community, it's all been about perseverance. I think the parents have persevered, as have the school district and the teachers. I thank Lisa Larson for her comments, but I also understand on the other side, the parents who are concerned about our most vulnerable students on these IEP plans. my last job in the district was reviewing the IEPs, making sure that that they were compliant with what teachers were requesting. And I think that we're going to, not only with our most vulnerable students and students on the IEPs, we're going to have to look at all of the students and see how our goals are going to be met, how we're going to move forward with these plans. So I did appreciate those comments. And I also think there's more to come on negotiations, realizing that they're probably leaning towards being in person. I do think members of the community want to know what's going on, probably more so this year than any year in the past. I know when I've been involved in negotiations, very few people show up. I think, if I remember correctly, I think I only saw Amy Bounds there. but I think that more community members are wanting to see how this happens and what goes on. So I think there's probably more to come on that, on how it'll be either live streamed or Dr. Anderson will probably let people know how they can tune in and watch that process. It's a very interesting process and a process that takes time. So thanks.
Okay, Kitty.
Yes, I would like to thank everybody who came to speak to us this evening. I am very excited that the kids are going to be able to go back to school 4 days a week. And I'm also really pleased that we're going to be working with the families that we have heard from and those we haven't heard from who did not want to go back 4 days and really only want to keep their kids in school 2 days. So I'm glad we're going to be able to accommodate everybody. And I want to echo what Donna said. I've never heard of anybody wanting to come to negotiations. It would be great. I mean, assuming we don't have like a room that's too full, but streaming or whatever, because I think you all would really be surprised at how we do negotiations in our district. It's a very collaborative process. So yeah, welcome to not participate, to observe. And that's all I have to say.
Okay, Lisa.
Not a lot. I had a great time at Uni Hill with Richard and Rob, and I think all I can say is that my kids want to make sure Rob, that if you need playground testers in the future, they're available day or night. They don't even need notice. They're happy to show up and climb on any structure you've got for them. But it was a great tour. We had a great time, and it was really fantastic to see all the work we've done there.
Stacy.
I don't have anything today. Thank you.
Yeah, thanks for coming and showing up. I know a lot of you've been here before, but it was good to hear from you again. And thank you also to Lisa for sharing the perspective from the Paraeducators Association. And it would be great if more people could come to negotiations. It did bring back this memory when I first started coming to board meetings. I was really worried that I couldn't get a parking spot because I assumed everyone just wanted to be there and wanted to go to all these meetings. And I'd show up early. I was like the only person in the building, So as much as this is a contentious time, we all have a lot of different opinions about how the pandemic is being navigated. Some people think we're being too cautious. Some people think we're being too aggressive. But we do have really high engagement. And I hope that we all harness that engagement and propel it forward and become really engaged with our communities. Again, we're having 2 school board candidate sessions. So please come, even if you're not sure you're interested, just come and learn about it or talk to any of us. We'll be delighted to speak with you. All right. So can we carry on? Is everyone okay if we keep going? Okay. So our next item is an information item. It's just our legislative update. So I know one bill that's coming up is this assessment audit. So this is a bill that's someone's going to designate a team. I don't think it's been very clear who would designate it, but they would look at the different assessment areas. And that's something that we probably need to talk about once the district has a position on it. Kathy and Rob, do you have anything else to add to that?
I was just going to ask Rob for an update, not today, obviously, about what we're going to be doing because we're going to have to be doing some testing, but I think there's still some question that maybe we can use local assessments instead of state assessments. So anyway, maybe in 2 weeks when we have our next board meeting, we can get an update on that.
Absolutely.
Okay. And then our lobbyists continue to send us bills that come up. So there's I think another question I'll have is a bill about the distance between a fracking site and a new school, since we'll probably be looking to build a new school in Erie. Just understanding if that's going to be a limiter for us. And I think we already went through this, and I think we already designated the land. So then anything that happens after that would not be in effect. But we might want to just understand what that is. So, and for board members who weren't there when we decided where to put Meadowlark, that was an issue with that school because it turned out that we built the school within the setback that was then placed after the legislation happened after we decided to build the school there. The land was dedicated, if that makes sense. Anything else? All right. Then our next item are our action items.
Tina,
Yes.
I might say that there were people that really tried to advocate that those setbacks be put in place, but at the time.
Yes, it was a big deal. Yeah.
Okay.
Yeah, that's why I think we should be aware of what's going on now for the same reason.
Okay.
Yeah. Very good. All right, so action items in consent grouping. 7.1 personnel items, 7.2 approval of minutes February 9th, 2021 regular meeting, 7.3 approval of minutes February 16th, 2021 special meeting, 7.4 approval of preschool child care agencies, 7.5 approval of multi-party collaboration agreement for prevention intervention services, 7.6 closeout to the construction manager general contractor contract for bond funded work at the central kitchen, 7.7 correction to resolution number. Do I have a motion to, I'm sorry, does anyone want to pull an item? Okay, could someone make a motion to approve the agenda? Okay, moved by Kitty and seconded by Stacy. Any questions about any of the items on the consent agenda? Kitty. You're on mute.
Sorry about that. I was looking at the board docs page, so I couldn't see it. I would just like to get some more information about the preschool child care agencies agreement that we're doing. If somebody could just explain to me what that is and why that is. I mean, I know it's required by law, but I'd like to know more about it.
Kathleen, would you like to take that on?
Sure. Thank you for that question, Board Member Sargent. So by law in Colorado, every 2 years, we need to go through a RFP process. That is what the board is taking action on tonight, is the outcome of that process to award the number of slots to the different agencies. It's important that the board does that about this time every year so that all of those agencies can begin the planning process for next year. So at this point, we're just asking the board to approve the award of those slots. We will be coming back to the board after, probably in a few months in May. If the board adopts this, takes this action tonight, then we will go and negotiate the contracts, and those will come back to this board for action as well.
So these are preschool slots, childcare slots?
These are preschool slots. These are community partners through whom we are offering preschool spots in order to meet a really complex web of obligations as to how we serve kids.
Okay, thank you.
Okay, any other questions? Okay, Laura, would you please call the roll on the motion?
Garcia,
Yes.
Gebhardt,
Yes.
Marquis,
Yes.
Myers,
Donna, you're muted.
Oh, yes. Sorry.
No
Yes.
problem.
Sargent,
Yes.
Sweeney Moran,
Yes.
Zis.
Yes.
Motion passes.
Okay, our next action item is Resolution 2109 in support of increased IDEA funding. This is the state resolution. 2 weeks ago, we passed a resolution requesting federal funding. And Kathy, I think you wanted to talk a little bit about this as well.
How could you tell I'm like ready to jump through my computer? I just urge everybody who's listening to read this resolution, because I find what the state of Colorado does as far as funding our special education and special needs students to be unconscionable. We decide how much money is kind of left over at the end of the day, and then we allocate what we know is already too little money for our students. And I'm very proud to say that the way we budget in Boulder Valley is not to take the pennies and try to apply it to our special needs students. We make them our priority, and we provide the services that we need to provide, which we do at great expense to all of our budget, because we know that that's an important thing to do. But the state doesn't share that value. And I really hope that other districts will look at this resolution. And I hope that people will join us in trying to pass this resolution. I also think it's really important in this resolution to just look at the difference in the percentage of special needs students that are served by the more traditional schools that we have as compared to the charter schools. So there's some really important information in the resolution, and this one is super important, especially to our future as we go forward. So I urge everybody to look at it. I'm really proud of the district for bringing it forward, and I thank everybody for the work that they put into drafting it.
Okay, do we have a motion to approve this resolution?
Sorry, you probably should have done that before I spoke. Sorry.
Yeah, well, I got 1 out of 2. Okay, so that was moved by Kitty and seconded by Stacy. All right, any other questions or discussion about the resolution? Anyone on CASB can socialize it with other school boards?
I think we can work on that.
Okay, all right. All right, Laura, could you call the roll?
Garcia,
Yes.
Gebhardt,
Yes.
Marquis,
Yes.
Myers,
Yes.
Sargent,
Yes.
Sweeney Moran,
Yes.
Zis.
Yes.
Motion passes.
Okay, so then the next steps is I will send this over to our lobbyists and let them know that we are supporting this resolution. And as we continue to set up meetings with either local or state legislators, I will continue to invite anyone to board to join in since we've taken a position on this. All right, now our next and final item is agenda setting. Anyone want to talk about anything for agenda setting? Kathy?
I just want to reiterate during this portion of the agenda that we get an update on how we're going to be handling the assessments in a couple weeks, so that communities know, because I think there's a fair amount of confusion about what we should be doing and what our responsibilities are as a district and what our responsibilities are as a school and as a parent. So I'm sure that'll come up. I just wanted to put a pin in that one.
Okay, Stacy?
We've talked on and off over the past year and a half about open enrollment being an agenda item at some point. And I was just wondering if we might get an update about how open enrollment went this past year, given the pandemic and all of that at some point.
Okay. Anything else, board members? I'll just add, I'd like to hear more about the assessment legislation, the audit assessment legislation, and understand where we are and whether we want to take a position on that and how. All right. Okay, so anything else? Final shot here? Great. Well, thank you all for your time. This has been great. I hope that we're in person soon. And have a great evening. This meeting is adjourned.